All right. Well, thanks everyone for coming today. We might as well get started. My name is Lee Graham. I'm the owner of Vintage Fitness, and I'm joined today by Anna Ferreira, registered kinesiologist and former competitive golfer. And we're going to talk to you today about how to get yourself ready for spring sports, in particular, how to avoid injury and be effective in your golf game. Does that sound good to everybody here?
Yep.
Okay, awesome. Just to make sure you're in the right place. So a little bit about Vintage Fitness in case you're not too familiar with us. We are a big team of older adult fitness specialists. We only work with seniors. And we've been doing so for 20 years and counting. So our clients achieve results with us, but we focus on a long-term vision with them. And it's not sort of like a quick fix bikini body situation. It's a long-term commitment to functional fitness and injury prevention and posture correction and the like. So this is me, and it's going to be myself and Anna here today. Mostly Anna doing the speaking because, as I mentioned, she's a former competitive golfer and very in the know. So we're really lucky to have her here today. So this webinar is for you if you want to improve your golf or tennis game. You want to avoid injuries this spring sports season. Maybe you have an injury already and you want to learn how to work around it, or you've injured yourself in the past and you might be a little nervous, or you could benefit just from some more balanced muscular strength. So today we're going to cover a few things, including performance tips and exercises. We're really actually going to go into the specifics of exercises that you can do. I feel like we're doing this amazing free giveaway. So it's really great that you signed up because most of this stuff you wouldn't get unless you were in like a one-on-one personal training session with someone who knows both seniors and golf. So I'm really excited that we can do this for you today and that you can take this knowledge forward with you. We're going to talk about common injuries that happen during golf and racket sports, ways to prevent them, which is actually possible, and then prevention and management exercises by body area. So I'm going to actually pass it over to Anna.
I'll just kind of quickly, actually, even before we do this, I want to go over a little bit. So I was a competitive golfer from the age of like 12 to 19. And I did play internationally. And so I'm originally from Trinidad and Tobago. So I was on my national team there. And then I played in the States, a little bit in Canada. And then I kind of retired when I moved to Canada for university. So just wanted to give you guys a little bit of a background there on kind of my golfing career. But in terms of, getting the most out of your game, tennis, golf, we want to make sure we have the cardiovascular capacity because that's going to allow us to find things easier. So especially golf, like it's 4 hours. It's very slow, steady state, but the more fit we are cardiovascularly, the easier it's going to be. And then we can give our energy not to just the walking, but to our actual shots. And then obviously tennis is a little bit more fast paced. And the more fit we are, the easier it'll be to return those shots. Okay. Both have a rotational component. So any exercises that's going to work on our rotational strength, so moving through that range of motion, either for tennis or for golf, is going to be beneficial. And kind of paired with that is having a strong core, especially those oblique muscles. So those two kind of go hand in hand. And that's going to, again, make you just that much better on the court or on the golf course. And then just having balanced muscular strength, both tennis and golf can be a very one-sided sport in a way, and you will start to develop like compensations on one side of the body because you are swinging to one side of the body mostly. Tennis less so because you have backhand and forward hand. I am not a tennis player, guys. I know the concepts behind tennis, but tennis is not my sport. So I'm gonna be very honest about that. Don't ask me for advice on your tennis technique. Maybe Lee can help you there, but I definitely can't help you with that one. But yeah, so having balanced muscular strength is gonna, help you to one, not develop issues outside of your sport from being so one-sided, but also just make you able to perform better. So we can go ahead on to the next slide. Ooh, maybe go back one.
Okay.
Same thing. Yeah, there we go. So there's different kind of exercises that we can do to improve our performance. We kind of talked a little bit about it before, but postural exercises, low back stretches, usually we get pretty tight into that area. Thoracic spine mobility, that's going to work in kind of in unison with those mobility and rotational exercises. And then we are using a lot of gripping muscles, so forearm and wrist stretches are going to be helpful, and then core exercises as well.
Oh yeah, there was one thing I forgot to mention is we're going to talk for probably like 30 to 40 minutes, and then there will be time for you to ask questions at the end. But there may be some questions that Anna will ask you during the presentation as well, and feel free again to ask her.
Yep.
Thanks. Okay, here we go.
Alrighty, so we're gonna go over a lot of exercises today. So to start, we'll kind of more chat about it. But if there's an exercise that you're like, oh, I've really never seen that before, and I need a demonstration, feel free to throw it in the chat or unmute yourself and ask. And there will be some that we will go over for sure. But in terms of postural exercises, we got some good options here. So we got our rows, could be a banded row, could be a dumbbell row, shoulder retraction. So just squeezing those shoulder blades together. That one's really easy. You can practice that anywhere, anytime. Chin tucks, a lot of us with technology and as we get age, we tend to be very push forward with the neck. So getting that nice in alignment, that's going to put less pressure on our spine when we're doing those rotational movements. And then banded pull aparts, so that's kind of another version of a row, another really good one there. And then chest stretch, because we do tend to get really tight into the chest, and that's going to pull us forward, put us in a not optimal position to perform in our sport.
Awesome. One thing I was going to say about the chest stretch is when you're doing it, make sure you're lifting your head up and your head is back, almost with a chin tuck again over your body. So you're not looking down with your head forward. You want to still be in that proper alignment, head on the body.
Really, really good cue there, Lee. And the other thing with the chest stretch is you can do one side at a time if you're finding the two is too intense. Also, if your door is really wide, the two arms doesn't work so well.
Right.
Okay, and then some other postural exercises and stretches. So that hip flexor stretch, we tend to get really tight into the hip flexors, and we want to be able to use that powerhouse when we're performing in our sport. Back extensions. So you can do back extensions multiple ways. This one's kind of a Superman that they have there. And a lot of us just don't use our posterior chain muscles, so they get pretty weak. And again, that's going to help with those rotational exercises. Glute bridges, strengthening those glutes, and then lat stretch, you can do that on a chair or a wall. Those are good options there.
Yeah, and with the glute bridge, you can do that from your bed if the floor is a bit of a barrier at that time. With the back extensions, to modify that one, you can make it a little easier by doing one arm and opposite leg and then switching to the other side rather than doing both at the same time if you're just starting out on a back exercise.
Yeah, and even trying just doing the arms or just doing the legs or one arm, one leg, like you can tailor it to your needs. And of course, if you're working with a vintage fitness trainer, we can tailor it for you as we go.
Absolutely. The thing I like about the back extension as well, just going back to that with the arms extended, is that you're also working on the shoulder mobility, which is important
Hmm.
for the sport as well. So good choice.
Yeah, for sure, for sure. These are some of the rotational exercises here. So this one, definitely, if you have any questions about them, let me know because I know not all of them will be familiar to people. Thread the needle is a pretty common one here. So this one's going to help with that thoracic mobility that we were talking about. And then the wood chop down is usually done with a band, and you're kind of coming from from up high and then chopping across. So that's really going to help with that rotational strength for those sports like golf and tennis. Wood chop down is one that we do want to be kind of mindful. Um, Again, just of our own limitations. If we have any spinal issues and stuff like that, we might have to adjust the range of motion. Um, but again, like if it's similar to the range of motion that you have in your golf swing and you haven't had any issues with it, it should be okay. But everything is case by case. So all of this is very general information, and it's best to have, those discussions with your trainer or other health practitioners to figure out exactly what's going to be right for you. Doing your golf or tennis swing, practicing it with either a weighted ball or even just like a ball hair. And that's again going to work on that rotational strength, especially if we have a weighted ball. So that's a good way to practice our swings at home. And then book openers is another good thoracic mobility exercise. And even just like the cross punches. So that's going to teach our body that rotational movement. And then if we add weight, again, we're doing that rotational strength. The power press is a really excellent core and rotational kind of, or more like anti-rotation exercise. So can be done with a weight or a band. I do prefer a band or a cable machine. And the band is going to be tied out to the side and you're pushing away, not letting the band pull you. So you're really having to engage those oblique muscles. So you can see it kind of in this picture, this second picture here, but really excellent exercise there.
Yeah.
Any questions on any of those before we move on?
Wait, what was the last exercise you just said? Sorry, there was a bunch of construction outside, and every time that you said the stretch or the exercise, it was like the loudest noise.
The parallel press.
Okay, thank you. Okay, got you,
Yeah.
got you. Cool.
Yeah.
Okay.
Alrighty. So we're gonna discuss, some of the common golf and racket sport injuries, and then we'll give you guys the opportunity to let us know kind of where your interests lie as well, so we can tailor the rest of the presentation to who's on the call. Okay. So of course this is not an exhaustive list, but generally tennis and golfers elbow is a really common one. And funny enough, golfers often get tennis elbow, not golfer's elbow. Golfer's elbow is less common in general. I've had both tennis and golfer's elbow. Funny enough, not from golf at all, from work, but and
How do you tell the difference between the two? I'm sure
that
they're
is an
wondering.
excellent question. So it just depends on what side of your elbow the pain is. So with correct me if I'm wrong, Lee, because I always get this confused. But with tennis elbow, it's usually on the outside. With golfer's elbow, it's on the inside. Did I put that reverse or is
I
that
think
correct?
that's right. I think that's right.
Okay. All
Yeah.
right. Sometimes I get confused. But yeah, so the more technical name for it is epicondylitis, so inflammation around the epicondyle joints. And if it's lateral, then it's tennis. If it's medial, it's golfer's elbow. They both suck, realistically, and the treatment is very similar for the both of them. Low back pain is another common one, and that's again coming from postural issues, people not having strong enough core. And then again, like we are putting a lot of force through our spine when we're doing those rotational movements, which is why we want to practice them. And then rotator cuff injuries is another common one. And wrist injuries, we're doing a lot of gripping, and then knee pain. So those are kind of the most common ones there. So how do we prevent some of these injuries? So a good warm up is definitely key. I think a lot of people do skip their warm up, but it is going to help really prevent injuries. And then strength training outside your sport so that we can fix some of those imbalances in our body is going to be huge as well. And then really important, we tend to sometimes want to, super tightly grip our golf club or our tennis racket, but the harder we grip, one often usually doesn't give you as much control. They say if you can hold the golf club, especially like firmly, but with a loose grip, you usually have more control of your golf club as opposed to giving it the death grip. And then also the tighter we grip is the more we're going to fatigue those muscles in our forearm and lead to the potential for wrist and elbow issues. And then variety. As I said, golf especially very one-sided. So the more that we can do other activities to balance off our body, the less likely we are to get, overuse injuries.
Amazing.
So
I
I
was going
guess,
to ask what variety is key meant for you. Yeah,
yeah.
makes sense.
So and even like playing golf and playing tennis, like the more you can have variety in your activity in general, it's going to make you a more well-rounded athlete and help your performance in all the sports. And
Yeah,
prevent that potential for injuries. I did want to kind of quickly touch on the fact that this is more geared towards preventing overuse injuries. Acute injuries are a lot harder to prevent. I mean, the back injuries, that is somewhat more of that pre-planning and doing those core exercises, those back stretches. But things like a sprained ankle, it's, harder for us to completely avoid that. Or if you like trip on a rock, like things like this is sometimes out of our control. But the more well balanced our body is, the more likely we are to recover from those potentials for injury and sometimes not get injured.
I think some people underestimate maybe the power of strength training outside of your sport as well. So I'm glad you included that because, in our business, we focus, of course, on training all the muscles so that you are balanced again. And the other thing that I think people underestimate is the importance of a warm up. And most of the people that we talk to are like, I know I should warm up before the golf game, but I don't really. And, you'll find that there's a really big difference in how it feels for you and it would be
For
much more
sure.
enjoyable. So that's a good incentive as well.
100%.
Right?
And some of the other helpful things here is remember you haven't done this, tennis and well, actually tennis or golf, you might have been doing a little bit through the winter. And if you have, then that's helpful. But easing back into it, it's just like gardening, just like anything else. If we go too hard, too fast, we are more likely to get injured because our body's not used to it. So just like we do a warm up before a round, we want to kind of warm up and ease ourselves into the season again. So not going too crazy. I know it's hard. We have short seasons in
Yeah.
Canada, so we want to make the most of it.
Same with cycling, right? Cycling's always a good one because when you get back on your bike, you're like, why is it so hard? Are both my tires flat? But no, you just have to do baby steps and be patient as you build it back up again.
Exactly, exactly. And then having proper form. So, as I said, that's something more to see, a golf professional or tennis professional. But if we can fix some of those bad habits, usually that's going to put us in that optimal position, not only for performance, but to prevent injuries if we're doing it the way that we're supposed to do it. And, finally, as we keep saying, working on that strength training outside of your sport, working on those problem areas, that's going to make a huge difference. So, does it actually work? And specifically the warm up, does that actually work? So there is some great research on it that we're going to chat about briefly because we want you guys to understand that we're not just making this up. There is science behind it. So when it comes to injuries, this is a quote from this peer-reviewed article, which is referenced at the bottom there. But injuries may be associated with lack of warm-up, poor trunk flexibility and strength, so that rotational strength that we're talking about, that core strength, faulty swing technique, and overuse. Implementing a training program that includes flexibility, strength, and power training with correction of faulty swing mechanics will help the golfer reduce the likelihood of injury and improve overall performance. I misspoke earlier. This quote is more about the strength training side of things, but we do have another one about the warm-up. So they are both important. Alrighty, so why should we do a warm-up? This is the quote I was talking about earlier. So it does increase the speed, force, and smoothness of muscular contraction. So our body will be firing those muscular contractions, will perform better. It's going to increase the nerve transmission and the temperature, which is a protective mechanism because then our body needs more of lengthening and stretching force on the muscles to have a tear happen. So it does work. There is science behind it. There is a good reason to do a warm-up. So let's go over a sample warm-up now. All right, so I'm going to do the warm-up with you guys. You can feel free to join along, see how it feels. And Lee will let me know if at any point you can't see me properly. So we're going to start with some arm circles. We can do this lots of different ways. I'm just going to show one way today, but we can make it bigger, smaller, forward, side. But we're going to just start with some sides. We're going to do 10 each direction. So 5, 6, 7, 8, 9, 10. Switching directions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And now we're going to do some
Just a quick note here that if you can't see Anna very well, you can make her bigger on your screen by going up to the place where you see all of us and just click on the full screen part for her and you'll see her better.
Awesome. Thanks for that note, Lee. And to go over the windmill. So we're going to look like a windmill. We're going to put our hands out to the side and we're going to twist and touch our opposite toe if we can. If we can't, we touch our knee, we touch our shin, anything like that. And if you do have a lot of spinal issues, then you can always reduce that range of motion. Just do a little tiny bit of movement if you have osteoporosis, stuff like that. So we're going to do those windmills here. And this is a pretty condensed warm-up because I know we want to get to our sport, but this is going to hit all those kind of major areas. So the other thing we're going to do is some mini squats. If you can do full squats, great. But just doing little baby squats, this is going to warm up our legs, get those glutes firing. So that's 3 there, 4, 5. And if you can't do a full squat, you can always sit into a chair instead. 8, 9, 10. We're going to do some butt kicks, so heel to bum. Getting the front of our thighs warmed up there. And of course, if you have problem areas, you can always spend a little extra time there. All right, I'm going to grab my band for this next one. So, depending on your shoulder mobility, you can do an overhead band pull apart. So bringing your arms overhead and squeezing apart. If you don't have that mobility, you can switch it to a banded pull apart in front of your chest there. But it is good to work on that shoulder mobility. And even if that's difficult, we can always do it without the band and do something like a squeeze down to the side is another good option, or if we forget our band at home. Okay, some side bends. Again, if you have spinal issues, just do nice small range of motion where we're just going side to side, get our spine warmed up, especially good for golf because we're going to be twisting a lot. Good, a few more here. And lateral lunges. So we can either step out to the side and hold that for a little bit longer if you're not as comfortable. If even that's hard, you can just do a little side shift of your hip. But if you're able to, stepping all the way out to the side, you can even alternate for some coordination work as well. So we'll do a few here. So this is going to get
it look so easy, right? Especially good with those twists, Anna. Yeah.
Yeah, so this one's going to warm up our adductors on the inside of our thighs. and that's a good powerhouse there. Some calf raises, so going onto our toes. I'm not holding on to anything, but if you're doing it for warm up, you don't need to work on the balance. You can hold on with a hand. So that's going to get those ankles nice and warm.
You
And
can
then
even use your golf club to hold it, on the ground a little.
exactly for
Hmm.
that support, for sure. And then if we have problem areas with either our ankles or our wrists, we can add in some movements for our wrists, some little wrist circles, some bringing the wrist to us, flexion extension. If we have a squeeze ball, we can do some squeezes. We can do a little bit of ankle circles. So all those are great options there. So that was a super quick warm up that you can do. And yeah, any questions on that? Everyone knows what they're doing. No questions.
Amazing.
Okay, so now we would really like to check in because the rest of the presentation we've set up by body area. So does, anyone have any specific areas that they're wanting to learn, how to prevent injuries, if you had injuries there in the past, or if you currently have an injury, how to kind of manage some of those areas. And, before we get into that, just a disclaimer that we are going to give you kind of general information. And obviously, there is going to be nuances and, specifics of each injury. Each person is going to be slightly different. So, always best practice to consult your healthcare provider, talk to your trainer to get, the specifics of what's going to be completely best for you. But this is some general information for management. So I want to hear from you guys. What areas do you want to work on? We got low back, knee, wrist. What's the problem areas for you guys?
One of
You
my
guys are at
clients,
perfect health.
one of my clients, he golfs all the time, but he is finding that he swings with his right, and he finds that he has consistent, tricep pain, and he's just using a lot of his tricep muscle, like doing the whole swing, like that's where he's focusing the most on. So I'm trying to
Mm-hmm.
figure out ways to help, alleviate that pain and help to try and like shift, I suppose, hit him just using that, tricep. So do you
And
have
that's
any
for golf
good?
or tennis?
That's for golf. So when
Okay.
he really puts it all in his right tricep, and you can tell it's very swole compared to his left. And
Yeah.
so I was just wondering if you have any ideas on because I have him, doing like, tricep extensions and stuff like that just to stretch it out. But I was just wondering if you had any ideas
Yeah,
or any advice, because
for
I'm not
sure.
the best at golf. And I'm like, this is perfect opportunity for me to ask the questions.
For sure. I mean, a few things. If he's able to do a few sessions with a golf instructor, that would be good to like clean up, form issues. The other thing is, where is he getting the pain? More at the distal insertion or more
No,
proximal?
it's more so it's not even so much like pain per se. It's just like tightness, and he's having a hard time like getting full range of motion because of the tightness, and it's within the full belly of like the tricep. So
Okay.
yeah, you know what I don't know if I'm explaining it
No,
right.
I think I understand.
Yeah.
So yeah, a few things. I would say, seeing a golf instructor
Okay.
to, work on form would be good. Making sure the other tricep is similarly in like
Yeah.
balancing it out.
Okay, yeah,
That's
that's
gonna
what I was
help.
thinking. Yeah.
Um, I would also work on the biceps because there might be an imbalance there, and that could
Mhm.
be
Okay.
contributing to that. And then if there
True.
is pain if he does end up experiencing any pain or discomfort with the triceps, doing some isometrics can help
Mm.
alleviate any pain with that.
Okay.
And then and for anyone on the call who doesn't, an isometric is a hold. We'll talk a lot about those today. So we're not moving the joint through a range of motion. We're just holding it in one position. They can also try some rolling with a ball along the muscle belly to release some of
Yeah,
that tension.
that's what I was suggesting. I was like, just try and like, it's very swole. I was like, we got a big tricep over here. Just try and alleviate some of that pain, maybe. A
Yeah,
lot of
alleviate some of the tension for sure.
yeah.
And then even like doing some eccentric work on the triceps to get a little bit of like stretch in through there, or even some like proprioceptive neuromuscular facilitation stretching could be good as well there. So completely different question than what we prepared, but awesome question. And I'm glad we're able to kind of chat about that.
Okay,
Anyone
perfect.
else on the call with, kind of problem areas? If not, we'll just start kind of going through by body area, and then if you have questions, we can deal with that at that time.
Okay.
Okay, so we will just go by body area. If I hit on one and you're like, oh, I really want to know more about this, or I don't know what that exercise is, like, can you show me more detail? We'll do that. So in terms of each body area, I've kind of broken it up into exercises for prevention and then exercises for management if you are currently having pain. The management exercises you can also use for prevention. Some of the prevention exercises may flare you up more depending on what the injury is. So that's why I kind of broke it up into the two. And that's where I say you got to talk with the people who are working with you, directly. This is just kind of more general advice. But things like our stress ball squeezes, I don't have a stress ball on me right now, but even just using a towel, doing some squeezes, that's going to work on our grip strength. Good one to do while we're just watching TV. And then pronation and supination are two important movements of the wrist. We can just take a weight and practice doing that pronation and supination. So that's going to work on some of those muscles there as well. And then all of our wrist movements, practicing that with a weight. Supported is best to start. I'm not completely supported here just to try and show you, but wrist flexion, wrist extension, radial deviation, and ulnar deviation. So those are kind of the main movements there. And then the farmer's carry, so having weights in both hands, or one hand is going to be better for balance, and just walking around with it. So I'll just quickly show you. I have very light weights, so I would ideally say a lot heavier weights, but just walking around with the weights, that's going to work on the strength into the arms there. In terms of management, you'll see a common theme in that all the management exercises generally are isometrics. So especially when we're having any irritation of tendons and inflammation, isometrics are the best kind of starting point, and then eccentrics usually is kind of the one after that. Concentric movements, so that shortening of the muscle, is what's going to irritate us usually more often. So same thing, doing the wrist movement, but instead of going back and forth, we can hold our flexion position with a weight, or we can even just use our hand and push against our hand trying to bring it up, but we're not actually moving through that range. Same thing for wrist extension, radial deviation, so thumb side, and ulnar deviation. So all of these we can do in an isometric form. And then we can work on our wrist flexion and extension by using a towel and sliding up the wall, so our wrist will get more and more bent, so more extended, which you can see in the photo. So that's another good one. And then towel finger scrunches. So I do have my towel here with me. So just practicing, I'm just going to put it down here so you can see, practicing scrunching our fingers together, pushing apart. All that's going to stretch out those little muscles. And then, of course, doing some stretches as well. So stretching our flexors and extensors. That's going to really help with any sort of pain that we're having as well. And as I was talking about earlier, that soft tissue release. So using a ball and rolling the forearm on, whatever side is tight, but doing both sides doesn't hurt. So yeah.
Would you
Any
usually
questions on
suggest
that?
a softball, or what do you like? What kind of ball would be good for that? Not too hard?
Not too hard. The harder it is, the more it's going to dig into the muscles, especially in our wrist and forearm. It's a very bony area. So we want to go for a softer ball, but we don't want something that when we put weight on it, it compresses. So this is I think this is a street hockey ball. So it's not very
Okay,
hard,
perfect.
but it's hard enough that I don't compress it when I put weight on it. Any questions on that before we move on to the shoulder? Okay, awesome. So in terms of prevention, we want to think about some of those rotator cuff movements. So doing our external rotation and internal rotation. We can do both of these with bands. We want to think about our shoulders also go forward, so flexion and out to the side, lateral raises, and we can do both of those with a weight. The overhead carry, not pictured here. Again, I have a lightweight. You would build up to heavier weight. If you don't have the stability or you have a lot of shoulder issues, this might not be the right exercise for you, but holding a weight overhead and walking around with it is going to really challenge the shoulder muscles and all those small muscles, right?
Start with a lightweight and then move up from there. Does that sound right?
Exactly, exactly. And first and foremost, you have to have that range of motion. If you can't get your arms overhead, you should not be adding a weight overhead. So we want to work on
Makes
that
sense.
mobility first.
Details,
So
yeah.
exactly. So we want to work on that mobility first, and then once we have that mobility, then we can try and weight it. And that's why I put an asterisk besides that one because it's not going to be right for everyone. For
Right.
management, as you'll see again, isometrics. So for the shoulder joint, most of these we just do against the wall. So pushing back into the wall for extension, pushing forward into the wall for flexion, out to the side for our lateral raise, our abduction. And then we can do kind of our arm in that 90 degrees, pushing out for external rotation, using a door frame on the inside and pulling in for internal rotation. And then bent over shoulder pendulum. So this one's really good to get that shoulder joint moving. So holding that weight. This one you want to use a slightly heavy weight because you're letting gravity and the weight do most of the work, and you're just making little circles to get the shoulder joint moving.
Oh,
And you can also go side to side and forward and
It's
back.
really good because it works on range of motion and strength at once, but it should be
Exactly.
gentle in terms of, again, the weight you choose, whether you choose none or something little. Yeah.
Exactly.
Good for
Exactly.
function. Great for shoulder function in general, but yeah, great for golf as well.
And I think with that one, the common mistake is that people will go in that bent over position and then try to make their shoulder do most of the work, but the weight and the gravity should do most of the work. So you are still doing a little bit of movement, but let gravity do the work.
Yeah, don't muscle your way through it, kind of release into it.
Exactly.
Same with a lot of the golf principles, right? Like we try to muscle our way through it when we're supposed to let go of it.
And usually we perform better when we let go a little bit.
I always
Okay.
say work smarter, not harder.
Exactly. For the knee, a lot of these probably very familiar with. So knee extension, straightening out the knee, knee flexion. We can do these with a band or ankle weights or even unweighted if we're a little bit more deconditioned there. The wall sit, really great one for muscular endurance of the leg. All you need is a wall. So, start with 15 to 30 seconds and slowly build up for it. The lower you go, the more challenging it will be. But again, see how you feel because you want to be able to hold it for a little bit there. Calf raises. So I was doing those earlier in the warm up, going on to your toes. And you can always hold at the top for a little bit more of a challenge as well. And then hip mobility is going to be hugely important because our hip affects our knee, our ankle affects our knee. So it's all connected. So doing hamstring stretches or reaching towards our toe or lying on the bed and straightening out one leg, or we can use a band to get the leg towards us. And then those side lunges I was doing earlier work well as an adductor stretch as well. Or you can just do that kind of slight hip bump that I was showing you earlier. And then there are
Right. Yeah. So the
other
adductor
exercises
stretch
there.
is great for strength and stretch, then, is what you're saying, which is wonderful. So it's great for prevention and it's great for a warm up too, which is kind of neat.
Yeah, if we're doing our not necessarily just an adductor stretch, but if we're doing a lateral lunge, we're getting both the strength and stretching in one movement, which is awesome.
We like
Uh,
those. Yeah. Kill two
we
birds, one
do.
stone.
Yeah.
Yeah,
Work smart, not hard, just as I believe Sarah
exactly.
just said. Uh,
Yeah.
again, isometrics for that pain management. So pushing our knee down into a towel or the bed or even the floor, but a towel is usually more comfortable underneath the knee joint. And that's going to contract our quad muscle, and holding that for a few seconds, that's going to help with that management of the pain. We can do the exact same thing with our hamstrings, usually with a little bit of a bent knee, really driving our heel into the ground. Isometric calf raise, which is what I was just talking about. So going up onto your toes and then holding it. You can do that sitting to start, is going to be easier. Standing a little bit more challenging. Stretching out those muscles as well. So making sure we're stretching out the front of the quads and then our hamstrings. So those touching the toes. And then if the standing quad stretch is too difficult, there are sitting modifications. There's side lying. So there's something that's going to be right for everyone. And then same thing, we can always use a foam roller to give us kind of a self massage and release some of the muscles if we need to.
This is such good information. I hope you are all taking it in. And remember, you're all going to get a recording of the webinar, so you can go back and look at these, of course, and practice some of them. We wanted to give you a lot of freebies today. So this is really wonderful. And also share with your other golfer friends.
Exactly.
Unless you just want to
So
beat them in the game and you want to have the leg up.
Tell them
I mean, what'd you say?
I said, tell them after.
Yeah,
Tell them
exactly.
after. Be like, I won this game. This is what I won. I've been practicing all these things. So for the ankle, again, just moving our ankle through all the ranges of motion, ideally with some resistance. So plantar flexion is going to be pointing our toes towards the ground. Dorsiflexion, our toes towards our face. Inversion, toes come in. Eversion, toes go out. So in all those directions, we can use a band, and we just want to tie it in the opposite direction to which we're moving. So if we're moving this way, the band should be pulling us the opposite way. We can also do it with ankle weights if that's easier. The arch drill. So if you guys have seen the fall prevention webinar, you will probably have seen this. But what we're really doing here, I'll show you with my hand and then I'll show you later with my foot. But we're trying to use these intrinsic tiny muscles of our ankle and our foot, and trying to really, it's more of a brain exercise than anything. We're really trying to force this arch up without lifting the top of our toes. So I'll quickly try and show you guys that as well.
Definitely harder than it looks. You kind of want to muscle your way through that as well. And it has to be more of like a visualization first.
I'm going to
It's
bring
really
you
great
guys
for fall
all the way
prevention
down
too.
to the floor here. Hopefully you can see my foot here. And actually an interesting point that I just learned as a way that I was cheating is we don't really want this joint hair by our big toe to come off either. So we really want to push that down and really just focus on lifting right through the arch, whereas I was kind of cheating by pulling up there as well. But we want to keep our feet down. We want to keep all these joints down, and we're just pulling up on that arch. So again, as I said, it's very much a mental exercise in a big way, because we've forgotten how to do that.
Yeah, I
Ankle
honestly,
circles.
I haven't done that in so long. I'm trying to do it now, and I'm like, oh my goodness, this is actually harder than
Yeah.
I remember.
It's weird. It kind of
That's a
reminds me
good
of like
one.
a pelvic floor exercise almost. Like you
Yeah,
again have
I
to
actually,
visualize it
yeah,
first before you go for it.
yeah, you
Yeah.
gotta really think about it. Yeah.
You do, because we don't do it on a daily basis, but it's such a great exercise for foot strength, foot mobility, any kind of ankle issues. It's a really good one for that. And then, ankle circles, we can do the alphabet, drawing with our big toe. That's another good one. And then calf stretches and dorsiflexion, so that bringing the toes to the nose, mobility. So I'll show you guys this one as well. This is one that I'm currently working on for some of my ankle issues. Let's see how I can position you there. Okay, so you should be able to see me here. You can pretend I'm up against the wall. I'm not going to be up against the wall, but we can have our back foot up and we're driving our knee over that big toe, which is okay as long as it's not giving you any pain. And we're working on trying to get more mobility in that dorsiflexion, so in that driving the knee over the toe. So that's another good one there.
Do you have your shoes on while you're doing that?
I prefer to do it without shoes on. Right now I'm just wearing socks.
Yeah.
It is best if you can do it without shoes on. It's a slightly different feeling with the shoe, and the shoe sometimes will restrict your ability to get full dorsiflexion. You can still do it with the shoes on, but I prefer to do it without.
Okay.
And then again, similar theme, isometric. So this is another one that's good to use either a wall or your hand. So same thing, if we're trying to bring our toes up, we can push with our hand to resist that. For pushing towards like the toes coming down, the wall is usually the easiest. We can push into the wall there. Plantar inversion. So when we're coming in, pushing with our hand. When we're coming out, pushing with our hand. So those are good there. If you do have issues with your hands, I would try and use a wall or even like the side of a table. Any of these can work. Sometimes I use like a leg from a table if I can get down on the ground and just push in, push out. Calf stretches. So that wall calf stretch, which we have there as well. And you can even do that mobility exercise that I was just showing as well. And then toe curls. So same thing like we do with our hands. So using a towel, scrunching our toes up. And even sometimes if I'm just waiting for something, I'll do that in my shoe, just practicing using those small intrinsic muscles of the feet. So all of that's gonna help. And then of course, if you need, you can always do some rolling out of the plantar fascia, so the bottom of the foot, with a ball or with like a frozen water bottle. And then rolling out the calf as well, either with a ball or the foam roller. For the low back, I'm just, how are we doing for time, Lee? Yeah, we're okay. We're still good on time. Perfect.
Yeah,
So
it's about 10 to 3, so yeah.
Yeah, awesome. So the low back, that lat stretch that was in one of those earlier slides is going to be helpful there. Having a strong core. Usually when our back is hurting, if it's not an acute injury, it's because our core is weak and our back is trying to help. So trying to be super strong in that core. Some of those exercises we like that Palloff press that we went over earlier. Glute bridge can be helpful as well. And then glute bridge is both core and strengthening those glute muscles, those posterior chain muscles. So that's going to help with protecting the back as well. So glute bridges, clams, side lying leg raises, all those are going to help support our back. And then those back extensions that we were talking about earlier, those can be really helpful. Rocking our knees side to side. That one's a really nice kind of like stretch a little bit. Not as much glute strengthening there. It shouldn't actually be under that category there, but it's more mobility into the low back and some relief. But we might have to tailor how much range if we have a lot of back pain, osteoporosis, any spinal conditions. We might want to just do a smaller range of motion to start. And then
those should be slow anyway too. Like these ones, just nice and gentle on your spine always. Better safe than sorry. But also you get a chance to feel things out and see how far you want to go, and go from there.
And using your core to come back. to bring the knees back. So keeping it tight when you're coming back.
I always say, not that you asked at all, but whenever I'm trying to explain like core things, like I remind people to suck the belly button in. Like that's kind of how like whenever like my client isn't really like understanding the core thing, I always go just suck your belly button in and then do the movement, and that way you're engaging the core. I don't know. I just found that was
and that's one I've used for the longest while, but kind of an interesting thing that I've learned recently, and I find it does make a difference. Sometimes harder with men because they're not able to conceptualize it a bit. But if we can actually engage the pelvic floor first by doing kind of like a
Mm.
Kegel, that allows us to use
Oh,
more of
that's so
our core.
good.
Yeah,
So
absolutely. And
instead,
then you get
I
the
yeah.
love
seat part.
that.
So
Yeah. Oh my gosh, that's
instead
so
of
smart.
asking them to suck belly button into spine, it's actually better to ask them like do a Kegel and tighten your core at the same time. And what it ends up happening
Okay.
is they kind of suck up almost up and
Yeah.
tighten at the same time. Whereas when they
Mm.
just do belly button to
Yeah.
back, they kind of cut
Yeah,
out
you're
the
gonna
pelvic
tilt the
floor.
pelvis. Yeah, yeah, true. So
Yeah.
smart.
So that's something I've learned recently through, learning about pelvic floor health. So that's
Yeah, no, I know that's
and
all.
that's
Thank you for being this smart.
that's great for everyone, on the call to try. Like if you can include that
Mhm.
Kegel with your core contraction, so much stronger, of a connection in there. Speaking of the core, bird dogs, we can do these on the wall, we can do them on the floor. Bee sit or boat, same thing. We can do chair, we can do it on the floor. That Palloff press we went over earlier. Plank. Plank is one that if we are facing down and we do have high blood pressure, especially if it's not managed well, we just want to be mindful because we're holding an isometric contraction with our face down. So that can be potentially a lot on the heart. So one to be a little bit mindful of. And then dead bugs is a great one. So lying on our back or on the bed, opposite arm, opposite leg. If that's too hard, even just holding our legs in that tabletop position is going to engage those core muscles to start. Thoracic mobility. So we went over some of these earlier. The thread, the needle, the book openers, the windmill. We did that in our warm up. Cat and cow is an excellent one as well. Again, tailor the range of motion to what feels good for you and what you know to be safe, from talking to practitioners. Child's pose is another good one. And then if we go a little bit wider with our child's pose, we get a little bit of an adductor, those inner thigh stretch as well. So I really love that as well. And then we can get a stretch kind of into our upper back and arms. So that's a really, really good one there. And then a lunge with a twist. So this is another way we can get mobility and strength at the same time. If we're stepping forward into that lunge, then doing a little twist. Again, just be mindful if you have spinal conditions, osteoporosis, stuff like that. We want to do a smaller twist.
Yeah, also slow on those and breathing at the same time. So these are just principles
Exactly.
that we're always reinforcing as trainers for seniors.
And what feels
Woohoo.
good to you as well, right? Like we never one of my biggest pet peeves is the fact that no pain, no gain exists. It is so wrong. So we don't
Yeah.
want to push into pain. We want to train outside of pain, and we can still get excellent results that way. So yeah, anyone have questions?
Brady or Brady Henderson.
I'm trying to think if I have any last questions. I interrupted you to ask them. Like my ADHD
That's
couldn't wait.
okay.
All good.
I was just
Oh my gosh,
gonna, I
I'm
was
really
just gonna
so
say, reminding the whole bunch here that like we had a lot of exercises that Anna went over. And again, like there's a big present gift wrap for you. Thank you so much, Anna, for doing all of that. That's a lot to go through. And just to mention that you don't have to do all of them. So the important thing to remember is you want to strength train your body so that it's all ready for anything, first of all. And then, you know, focusing on the core strength for sure for golf. What else would they prioritize, Anna, if they don't have any injuries and they just want to like kind of do the bare minimum or, the essentials?
I would say if we can maybe only choose two things and we don't have any injuries, core strength and thoracic mobility. Because we are moving our spine, especially with golf, at a high speed. So we want to make sure that we have the mobility to do that movement and that we have the core strength to be able to support it. And I think with that, just keeping in mind that core is so much more than just our belly in the front. It is also those posterior chain muscles in the back. So those things like back extensions, even our glute work, like all of that is going to support us. And I think just do what you can. So if you only have, 5 minutes, choose a few exercises that hit a good range. And that's really what I tried with that warm up, is to give you everything in a short little package.
Oh, I'm muted. Sorry, I was just the frozen water bottle is such a good idea. I've never even thought about using that to like roll the foot out.
Hmm.
10 out
Yeah.
of 10, yeah.
The one thing with that is I always just say only a few minutes, or
Yeah.
it'll get pretty cold pretty quickly.
Yeah.
Um,
I literally wrote
but
it in highlight. I was like, I'm doing that in a bit. That sounds amazing.
yeah, it's so good, especially for plantar fasciitis. That's a really good one there. Or even sometimes just taking an ice cube. Like an ice cube is going to
Mhm.
be more intense
Yeah.
than an ice pack. So again, like 5 minutes or less. But you can really get in there, and like they even also sell like little like half balls, so you can do like
Yeah.
you can freeze them, and then you can do like the rolling with the ice at
Oh,
the same
that's so
time.
smart. I don't know. I never thought about that.
Hmm.
I
Yeah.
definitely got that too. Slay.
Yeah. Are there any other questions with the bunch? And feel free to reach out to us later if you have some later that you forgot to ask today or you don't want to share in front of the group. Of course, you have this to reference later on as well.
Anna, you did a wonderful job of it. Good job.
Thank you. Thank you. I hope you're keeping well, Carol.
I am. I am.
Awesome.
But
Isn't
this
she
still
amazing?
helps.
Yeah.
Happy
Well,
to hear
thank
your
you
voice,
everyone
Carol.
for coming today. It was so good to see some of you and hear some of you and just be near some of you. So thanks for taking the time out. Feel free to share this when I send you the recording with whoever. Again, you don't need to beat in the golf game. And remember, you can reach out to us anytime if you need some strength training with seniors fitness experts and you want some help. That's what we do, vintagefitness.ca. So all the information's there on how you can reach out to us. And you can also watch past webinars. We do them every 6 to 8 weeks. And there are so many different topics relating to seniors' health and wellness. They're all free and they're all there for you to absorb anytime to just keep bettering yourself every day. So
And
thanks again for coming.
I was just going to add on that note, we do have one from last year that we did a garden fit because I know, a lot of our clients love to garden as well. So if you're doing gardening through the garden season, that would be a really good one to look at. We talk about, similar concepts, how to make sure we don't get injured and then enjoy our gardening. So yeah. And I hosted that one as well. I love to garden as well.
Yeah, she's a gardening lover as well. So yeah, that I
Mhm.
know that'll appeal to you as well, Lynn. So vintagefitness.ca, go to free resources, and then you'll see all the old webinars. So just scroll through, and when you have a little bit of time on your hands, pop your headphones in and learn with us.
Awesome. Thank you everyone
Thank you
for
again, Anna.
coming
Thank
out.
you, everyone.
Thank
Thank
you.
you.
Take
Bye.
care.